Most people don't notice this until it's too late. You've worked hard your entire life. You raised children, maybe even grandchildren. You sacrificed, saved, and did what was right. But one day, you open the refrigerator and realize the groceries won't last a week. Or you get a medical bill that leaves you breathless. And in that moment between pride and panic, you begin to wonder, is there any help for someone like me? What if I told you the signs were there all along, hidden in plain sight? The truth is, millions of older adults in America are eligible for government assistance programs, but never apply. They either don't know about them, assume they won't qualify, or, perhaps most tragically, feel too ashamed to ask. If you're over 60, this could change how you see the next 10 years of your life. This isn't just about benefits. It's about dignity. It's about survival. It's about knowing what you've earned and how to access it without feeling like you've done something wrong. Why is it that so many people hit retirement age still struggling to put food on the table or afford necessary medical care? Despite programs like SNAP, Medicaid, Medicare Savings programs, SSI, and LIHEAP, why do some seniors suffer silently, while others tap into these lifelines that can make aging not only manageable, but peaceful? By the end of this video, you'll know exactly what to look for, what questions to ask, and how to break through the confusion surrounding eligibility for these programs. Because aging gracefully isn't just about staying active or finding joy in the little things. It's also about knowing your rights, protecting your future, and accessing what you need without guilt. Let's start with one of the most misunderstood programs, SNAP, the Supplemental Nutrition Assistance Program. In everyday terms, we call it food stamps. But what it really is, for many seniors, is the difference between eating well and going hungry. What most people don't realize is that SNAP benefits are often higher for older adults living alone, especially those on fixed incomes. Yet every year, nearly 5 million eligible seniors never apply. Why? The confusion usually starts with assumptions. People assume you need to be on welfare or have no income at all. Others believe that if they own their home or have some savings, they won't qualify. In truth, SNAP eligibility for older adults aged 60 and up has special rules. For example, if you have high medical expenses like prescription costs, transportation to appointments, or medical devices, you can deduct those from your income when applying. That alone can make a huge difference in your eligibility and benefit amount. And yes, even if you have Social Security income or a small pension, you may still qualify. Then there's Medicaid, which people often confuse with Medicare. Here's the simplest way to remember the difference. Medicare is a federal health insurance program for people 65 and older, or under 65 with certain disabilities. Medicaid is a joint federal and state program that helps with medical costs for people with limited income of any age, and often includes benefits not covered by Medicare, like long-term care. Where it gets messy is in the overlap. Some people qualify for both. These are known as dual eligibles. If that's you, you could be getting help with premiums, deductibles, copays, prescriptions, and more. But many seniors don't realize they qualify for Medicaid because the rules vary from state to state. In some states, you can have up to $2,000 in assets, excluding your home and car, and still qualify. In others, the rules are more generous. And here's where the emotional part kicks in. So many seniors feel ashamed even thinking about applying. I've never taken government assistance, they say. I don't want to be a burden. But you're not a burden. You paid into these systems your entire life. These programs were created for moments like this, for people who worked hard and now need support to age safely. But there's one sign almost no one talks about, and it's the most important of all: silence. Silence is the most dangerous indicator. When a senior stops mentioning doctor visits, or quietly starts skipping meals, or avoids filling prescriptions because they don't really need it, that's when the red flags start waving. These aren't just budget cuts, they're cries for help. Take Alice, a 72-year-old widow from Missouri. After her husband passed, her monthly income dropped to just over $1,100 in Social Security. Her rent was $700. After utilities, she barely had enough for food. But Alice was proud. She didn't want to bother her children. She thought SNAP was for other people. It wasn't until she landed in the ER for malnutrition-related complications that her social worker helped her apply. Today, Alice gets $150 a month in food assistance, and she wept when she realized it meant she could finally buy fresh fruit again. You might think you've heard this before, but here's the twist. Most of the application barriers aren't financial. They're emotional. Fear, pride, confusion, paperwork. These are the real enemies. Let's walk through some of the key programs and eligibility rules you should know, because clarity is power. First, the Medicare Savings Programs, MSPs. These can help pay for Medicare Part A and B premiums, deductibles, and co-insurance. If your income is below a certain limit, roughly $1,600 per month for an individual, higher for couples, you could qualify. There are 4 different types: QMB, SLMB, QI, and QDWI. Each has slightly different income and asset rules. But most people never apply because they assume Medicare covers everything. It doesn't. If you're paying out of pocket for doctor visits or prescriptions, you might be eligible for one of these programs. Then there's SSI, Supplemental Security Income. Different from Social Security retirement, SSI is for people with limited income and few resources. If you're over 65 and struggling, SSI can provide monthly cash benefits. Even if you're already receiving Social Security, you might still qualify for a small SSI check to help bridge the gap. The income and asset limits are strict, but many seniors living alone with no additional savings do qualify. And we can't forget LIHEAP, the Low-Income Home Energy Assistance Program. Winters can be brutal. Summers can be dangerous. LIHEAP helps pay heating or cooling bills. In some states, it even provides weatherization services to make your home more energy efficient. Eligibility depends on income and household size, but it's a lifeline for many seniors facing utility shutoffs. Now, let's talk about the paperwork. This is where people give up. Applications ask for income statements, bank balances, proof of residency, sometimes even medical bills. It can feel overwhelming, but here's the truth. You don't have to do it alone. Many communities have aging resource centers, nonprofit groups, or benefits enrollment counselors who will walk you through the process for free. If you're not sure where to start, call your local area agency on aging. They're not there to judge. They're there to help. Coming up, the one moment that still brings tears to my eyes. It was the day I sat with my uncle, who had just turned 68. He had worked in a factory his entire life. Never missed a day unless he was in the hospital. He assumed retirement would be peaceful, but he couldn't afford his heart medication. I remember watching him break a pill in half to make it last. That moment haunted me. It still does, because I realized he didn't need to suffer. He just didn't know where to turn. We applied for extra help, the Medicare Part D Prescription Assistance Program. He was approved in 2 weeks. His medications went from $400 a month to under $30. He cried. I cried. All because we asked the right questions. Please, if this reminds you of someone, if it reminds you of yourself, drop a comment below. Tell us, have you or someone you know ever struggled with these programs? We need to talk about this more. We need to normalize getting help when we need it. Another barrier many seniors face is the internet. A growing number of applications are online. That's fine if you're tech savvy, but what if you're not? What if you don't have a computer, or you're nervous about entering personal information? That's where libraries, senior centers, and trusted family members come in. Don't be afraid to ask for help with the application process. It's your information. It should work for you. And one last note on eligibility. Even if you've applied before and been denied, circumstances change. Income drops. Medical costs rise. You can reapply. In fact, it's recommended to review your eligibility yearly. What didn't work 2 years ago may work now. Let's recap the biggest lessons. SNAP isn't just for families with young children. It's for seniors too. Medicaid isn't just for poor people. It's for people with medical needs. Medicare Savings programs can save you hundreds a month. SSI can provide much-needed extra income. LIHEAP can keep you warm in the winter. Extra help can make prescriptions affordable. And none of this is charity. It's what you've earned. We all age, but how we age is up to us. If you or someone you love is struggling to afford the basics, food, medicine, energy bills, please know you're not alone. These systems are complex, but they exist for a reason. The trick is knowing how to navigate them. So take that first step. Ask the question. Make the call. Apply, even if you think you won't qualify. You might be surprised. And if you've already walked this road, share your story in the comments. You never know who needs to hear it today. If this reminded you of someone, share it with a friend. You never know who needs to hear it. And for more stories, support, and real talk on aging with dignity, follow us here at Aging Gracefully 60. Let's grow older, smarter, safer, and stronger together.